Hello everybody and welcome to our live stream. My name is Anna Marie. I handle all the school-related function here at the Academy. I am joined today by the wonderful Mr. Joe Zuther, the founder of the Academy of Lymphatic Studies.
Thank you, Anna Marie. I would also like to thank you all for watching this live stream, and thank you for all your questions that are wonderful and interesting. I hope I can answer those questions for you sufficiently.
She says, can you talk about how common lymphedema is?
How common lymphedema is, that means the incidence rate of lymphedema. Now, I have to start first, Krista, by telling you that there are different types of lymphedema. Depending on the etiology, lymphedema can be classified as either primary or secondary, and the incidence rate of those two types of lymphedema varies greatly. Let me tell you a little bit about primary lymphedema. Primary lymphedema develops as a result of a developmental malformation or an abnormality of the lymphatic system which you are born with, which does not mean that primary lymphedema always is present at birth, which in which case it would be called pediatric lymphedema. Primary lymphedema usually develops at a later stage of life, usually during puberty or pregnancy. Now, if you have a malformation, most common forms involve hypoplasia or hyperplasia, sometimes aplasia of the lymphatic system. Without going too much into detail, if there is a congenital malformation of the lymphatic system, lymph nodes or lymph vessels, those affected lymph vessels are not as efficient as normally functioning lymph vessels, which could lead to the onset of lymphedema. Now, when it comes to the incidence of primary lymphedema, approximately 1 out of 5,000 individuals are affected by primary lymphedema, predominantly females, with a ratio of 1 male to 3 females, to 3 females. And also a general statement that can be made for primary lymphedema, it usually affects the lower extremities, as opposed to secondary lymphedema, which I would briefly cover right now. Secondary lymphedema involves not only the lower extremities, but also the upper extremities. The truncal area can be affected, the abdominal area can be affected, the head and neck area can be affected, as well as the exterior genitalia. Now, secondary lymphedema results from mechanical disruption or obstruction of normally functioning lymph vessels or lymph nodes. As far as incidence is concerned, like post-surgery, in most cases in the United States, post breast cancer, for example. Now, as far as the incidence is concerned, it is estimated that around 140 to 250 million cases of lymphedema worldwide are estimated to exist, with lymphostatic filariasis, which is a parasitic infestation of the lymphatic system, being the most common form. I know it sounds horrible. There's actually a parasite, it's called Wucheria bancrofti, that is located inside the lymph vessels and causes an obstruction, which in turn causes lymphedema. Thank God, don't be afraid. Those parasitic infections are not at all common. A common cause for secondary lymphedema in the United States, lymphostatic filariasis, is endemic in over 80 countries, so it is common. But mostly people in India, Africa, Southeast Asia, and some Pacific islands are affected. And as I already mentioned briefly, the most common cause for secondary lymphedema in the United States are surgical interventions that include the removal or the radiation of lymph nodes, most common in breast cancer patients, not limited to breast cancer patients. There are also other cancers that involve those procedures, but breast cancer, as we all know, is a very common condition. In fact, the latest available statistics that I was able to pull up are from 2017 from the American Cancer Society. And in 2017, 225,000 new cases of breast cancer in females and 2,200 cases of breast cancer in males were diagnosed in the United States. So secondary lymphedema is certainly the more common form of lymphedema.
Wow, Joe, thank you for that information. Our next question comes from Cindy. She says, I have lymphedema in my leg, which started in 2017 following a hysterectomy. How long can I wait to start treatment?
How long can you wait to start treatment? You should not wait that long, Cindy. Now, you must know, and you may know already, that lymphedema is a progressive, it's a chronic condition. Progressive means it does not, in most cases, get better by itself. It progresses. That means it becomes worse, it goes through stages. And if lymphedema is left untreated or poorly treated, can lead to significant physical problems in the affected extremity. For example, if lymphedema is left untreated, infections or cellulitis attacks are very common, which necessitate frequent hospitalizations. If lymphedema is left untreated, it sometimes grows to extreme proportions, which is known as lymphostatic elephantiasis. There are skin changes associated with untreated lymphedema, such as papillomas, warts, and other complications. So again, it is really, really important to start lymphedema treatment as soon as possible, because with early treatment, most of those secondary changes can be mitigated significantly by appropriate treatment. And when I say appropriate treatment, obviously I'm talking about complete decongestive therapy, or CDT, which is the most accepted treatment modality for lymphedema. In fact, it is often referred to as the gold standard in lymphedema therapy. In fact, it is listed on many main websites, like the website of the National Cancer Institute, the International Society of Lymphology, as the main component in the treatment and management of lymphedema, and shows excellent long-term results if it is applied correctly by a skilled and certified lymphedema therapist. Now, if you go for treatment for lymphedema involving complete decongestive therapy, you have to make sure that the treatment is applied by a therapist who knows what he's doing. And when I say that, I mean a certified therapist. A certified therapist undergoes 135 hours of training in lymphedema therapy in a school that meets the requirements set by the Lymphology Association of North America, or LANA, for the training and certification of lymphedema therapists. So again, treatment needs to start as soon as possible to avoid all those secondary complications.
Right, so that brings us perfectly into our next question from Barbara. She says she's not quite sure about the appropriate treatment from her therapist. How would she know, or can you explain briefly the proper treatment?
Okay, proper treatment again is CDT, or complete decongestive therapy. Now, CDT is composed of 4 treatment modalities, so it's a multi-component treatment approach. One of the components is known as manual lymph drainage, or MLD. Manual lymph drainage is a very gentle, superficial treatment technique designed to stimulate healthy lymph vessels and to move stagnated lymph fluid around blocked areas through tissue channels. And you can achieve that by techniques known as manual lymph drainage. Now, many people confuse manual lymph drainage with massage, like regular massage or Swedish massage. Great therapy. However, manual lymph drainage and massage have nothing in common, only that both therapies are applied manually. As you know, with massage therapy, you want to go deeper, you want to treat the skeletal musculature, and you need deep pressure. With manual lymph drainage, you only want to affect those lymph vessels that are located in the skin, meaning above the muscle layer, so you need very light pressure. So this is manual lymph drainage. Second component of complete decongestive therapy is compression therapy. Now, compression therapy is an indispensable part of complete decongestive therapy. You have to know that if you have lymphedema, you have a swelling, you have stretched tissues, and that's stretching over an extended period of time damages the elastic fibers in your tissues. That means they become fibrotic, and the physiological elasticity may never be regained completely after lymphedema therapy, after the lymphedema is decongested effectively. So there's always a risk of reaccumulation of lymph fluid. So in other words, if you do manual lymph drainage and you move lymph fluid out of the affected extremity manually, and you would not follow up with compression therapy, lymph fluid would inevitably reaccumulate in those tissues. Now, compression therapy, depending on the phase of the therapy, is applied either with specialized compression materials, padded compression bandages, for example, so-called short stretch bandages. Nothing to do with ACE bandages, completely different thing, or compression garments. But again, This depends on the stage of the therapy. The third component of CDT is skin and nail care. Now, as you most likely know, those of you watching, lymphedema of the skin is very susceptible to infections. It is dry, it needs to be moisturized, it needs to be inspected frequently for any fissures or cracks to avoid infections. So skin and nail care is also an extremely important part of lymphedema management. The fourth component are exercises. Now, exercises help the decongestive effect. They support the decongestive effect of MLD and compression therapy. Decongestive exercises are performed, which help evacuate lymph fluid even more post MLD and compression. Okay. But apart from decongestive exercises, if there are any other exercises that need to be involved, to increase your range of motion or increase your stretchability, that is up to the therapist. So you can combine decongestive exercises with stretching exercises, aerobic exercises, pool exercises. Even yoga is a very efficient complementary exercise modality for lymphedema, or especially if you're affected by lower extremity lymphedema with diaphragmatic or breathing exercises. If you do breathing exercises, proper breathing exercises, the upward and downward movement of diaphragm in combination with the inward and outward movement of the rib cage increases the flow of lymph and venous fluid in those vessels located in the abdominal area. So this is a brief recap of what CDT is composed of.
Perfect, Joe. Thank you so much for that information. There's another question from Ruth. She says, can you explain lymph pumps?
Lymph pumps. So lymph pumps, I'm sure you're referring to intermittent pneumatic compression devices, or IPCs. An IPC consists of different components. One component is a sleeve that you apply on top of your extremity. Upper and lower extremity applications are available, also truncal applications for the head and neck. And those sleeves are inflatable. That means they have multiple compartments that are separated from each other. And each of those compartments is connected to an electric pump, which supplies compressed air via air hoses into those compartments. So those compartments fill up from the most distal part of the extremity, so close to the hand, to the most proximal part of the extremity, like your shoulders or your thigh, and help the decongestive effect that you achieve with manual lymph drainage. However, it needs to be pointed out that, and there's also a broad consensus in the medical community and pump manufacturers, that IPCs or lymphedema pumps should never be applied as a sole component in lymphedema management. It's an adjunct therapy to lymphedema therapy, to complete decongestive therapy, an additional, and in many cases very useful addition, but only if it's combined with complete decongestive therapy. And also, if you allow me to point it out real quick, there are newer generation compression pumps and older generation compression pumps. These older generation compression pumps, they also have sleeves, but they don't have multiple compartments. They have one compartment. So those are no good to treat lymphedema because you do not have a compression gradient. You need more compression on the distal part than on the proximal part. So if you decide to go for pump treatments, you should use those newer generation compression pumps, which are also known as type 3 pumps. And another addition I would like to make at this point, CMS, the Centers for Medicare and Medicaid Services, actually reimburse the use of pump for the home care setting, but only if a 4-week trial of conservative therapy, meaning CDT, shows no significant results.
Okay. All right. So real quick, I want to just interrupt before we get to our next question. There's a shout out by DG Carr. It says, keeping up awareness drive in Trinidad and Tobago. So proud to be a certified lymphedema therapist.
Oh, that's good.
Congratulations.
Hello to Trinidad and Tobago. And that just remind me, also with the IPCs, you should know that there are a number of contraindications where those IPCs are contraindicated in the treatment of lymphedema. One of them is non-pitting lymphedema. That means if you have a very high protein or very high fibrotic component in your affected extremity, pumps should not be used. Pumps should not be used if you have infections or inflammations in your veins, like a thrombophlebitis or phlebothrombosis. They should not be used with cardiac insufficiencies, pulmonary edema, and others. So be aware of those contraindications.
Awesome. Perfect, Joe. Thank you. So let's go into Frank now. He says, I hate my compression stocking. Do I really have to wear it every day?
Yes, Frank, the short answer is yes. I know it's cumbersome. I'm aware of that. I know many patients, and the majority of those patients is not really happy to have to wear them on a daily basis, but unfortunately it is necessary. There is no cure for lymphedema. There is no magic pill, you know. Lymphedema needs to be maintained, and the only way to maintain lymphedema, and as I pointed out before, you know, the elasticity of the skin is inefficient. So if you do not wear your compression sleeve, you do have a risk of reaccumulation of fluid. Now, I am aware that some of you, especially those who have upper external lymphedema, like if you have to go to a function, for example, you don't want anybody to see your garment, you may decide to leave the garment off for a couple hours, which is fine in some cases, but as soon as you see a detrimental effect, like an increase of swelling, you should always wear your compression garment. It's really a very, very important part of lymphedema therapy.
Awesome. Thank you for that, Joe. Now, Audrey has chimed in. It's another question that just came in. She says, what are your thoughts on treating patients with active cancer?
Treatment of active cancer. Well, in short, if you have an active malignancy, complete decongestive therapy is contraindicated. However, this always depends on the treating and the referring physicians. You know, lymphedema therapy in active cancers, they can have a palliative role, you know, for example. So yes, there is a contraindication, but if your treating physician is of the opinion that CDT would be an advantageous therapy for you, then it can be applied. But it really depends on the physician.
On the physician. Okay, perfect, Joe. Thank you. So Melanie says, could you talk briefly about LVA surgery, success rates, best way to follow up? She's a patient.
LVA surgery. So for those of you who are not familiar with that abbreviation, LVA stands, it's a surgical procedure. It stands for lymphovenous anastomosis. And anastomosis is a connection between two vessels. In this case, it would be a connection between a lymph vessels and a small vein adjacent to those lymph vessels. So when those surgeries are performed, the surgeon, who should be very knowledgeable in lymphedema, by the way, makes a small incision and connects lymph collectors directly into adjacent veins. And that allows the lymph fluids to drain directly into the veins and thus bypass the blocked area. Now, I again have to point out that there is a broad consensus in the medical community, so this does not come from me. You can read that up on any appropriate website. A broad consensus in the medical community that surgical procedures are not for every lymphedema patients. There is only a select group of patients that actually are good candidates for surgical procedures. Okay. And surgical procedures can never be applied without complete decongestive therapy pre as well as post-surgically. Also, you have to be aware that if you decide to go for a surgical procedure, it is still always necessary to wear compression garments post-surgery. Okay. I think she also asked something about success rates.
Success rates.
I looked it up briefly because I got that answer previously. I was able to pull up a 2017 report from Winters et al. That included a cohort of 20 patients affected by upper external lymphedema post breast cancer surgery, and a 12-month follow-up indicated that specifically with LVA surgery, there was a success rate of 33%. That means the average reduction in lymph fluid with LVA surgery was 33%. However, there was also one patient that had an increase in lymphedema.
Oh, okay. All right. Well, thank you for that information, Joe. The next question comes from Susan. She says, how can I learn to do follow-up treatments on my own after I saw my therapist?
Very, very important question, Susan. Thank you for asking that question. Now, as I have mentioned before already, or as you may already know, CDT is performed in two phases. There's the intensive phase where you see the therapist on a daily basis. Therapist takes measurements, and if those measurements approach a plateau, the end of the intensive phase is reached, and the patient goes continuously into phase 2, which is the self-management phase, in which the patient resumes responsibility to maintain and often improve the results that were achieved in the intensive phase. And during the intensive phase, your therapist should have instructed you in certain easy to learn and easy to apply techniques of manual lymph drainage. You should know how to don and offer compression stocking, perform your exercises, apply appropriate skincare. Now, if for whatever reason you were not instructed in those self-management procedures, you can go to one of our websites, which is known as lymphedemablog.com, so www.lymphedemablog.com. And there's an index part on the left side of the homepage which refers to certain articles, and many of those articles are geared towards self-management. So they include pictures, instructions, and how to do self-managed drainage for the upper and lower extremities, how to don and doff compressions, stockings, garments, and so on and so forth. So again, I urge you to go to that website and
That's great
find an article.
information,
Yeah.
Joe. Great. All right. Anne has a question now. She says, I was told that I should not have any injections or blood draws on my lymphedema arm. Why is that?
I'm so happy to hear that, Anne, because this is a major issue. Now, any injury or trauma can trigger the onset of lymphedema if you do not have lymphedema yet, or can make the symptoms of existing lymphedema worse. Now, blood draws, injections are injuries to the skin. The doctors, the nurses, they do have to insert a needle into the extremity that could cause, that could serve as an entry point for bacteria or pathogens, which could in turn cause a cellulitis. So absolutely, do not allow anybody to take blood or apply injections in your affected extremity, let it be the upper or lower extremity. Also, blood pressure reading should not be taken on the affected extremity. Many nurses, I have to say, I'm sorry if I would offend anybody, but many nurses are not aware of the fact that you actually can take a very accurate blood pressure reading on the lower extremity. If you know how to do it, there's a certain amount of millimeters mercuries you have to add to the number when you take lower extremity measurements, but it's certainly possible. So no blood draws, no blood pressure in the affected extremity. Any kind of injury should be avoided. For example, if you need to shave, like you guys or the women, you should never use a razor blade. You should always use an electric shaver. If you have pets, you should wear gloves when you play with those pets, so you don't have scratches by a cat or whatever. If you do gardening, to avoid injuries with a rose thorn, you should wear gloves. Also, mosquito bites are often the cause for the onset of a cellulitis. So especially if you live in mosquito-infected areas, or if you plan to travel into mosquito-infected areas, please take an insect repellent, a mosquito repellent with you. Also, it's always a good idea, if you have lymphedema, always to carry an alcohol swab and an antibiotic ointment with you in your purse or in your pocket, just to make sure you clean it up, put a little band-aid over it, and just to avoid any onset of infections. And always moisturize your skin.
Always. Good job, Joe. Good. Thanks for that information. I have a follow-up question regarding CDT. It says, which exercises are most important?
There's no clear answer to that. As I mentioned before, I believe I did that. Exercises are always an individualized program for lymphedema therapists. Sometimes you don't only have lymphedema, which requires decongestive exercise, but sometimes upper extremity lymphedema may decrease your range of motion, in your shoulder joint. Maybe you have less stretchability in your musculature. So it all depends what your therapist recommends. That is very, very important. I think we mentioned that before already, water exercise, aquatic exercise. So those exercises are good. Yoga is very good, but always make sure to double check with your treating physician and your lymphedema therapist which exercises are good. And again, I would like to mention that certain exercises you should avoid. For example, running with a lower extremity lymphedema is not a good idea. However, if you are a runner and you would love to continue running, please do so. Please do so, but do it with your compression garment in place. Nobody wants to tell you can't run anymore. But if I may add that and be a little bit more strict, if you have upper extremity lymphedema, do avoid sports that include a racket, like golf, squash, tennis. Those are really activities you should not do as a patient affected by lymphedema. Also, kickboxing is not a good idea if you have lower extremity lymphedema. So make sure that also those beneficial or good exercises, if I may put that in parentheses, good exercises, they're also listed on the Lymphedema blog website. There are articles that cover that as well. And before we run out of time, I don't know, do we have time left?
We have a few more minutes.
We had just some last minute questions come in. One is from Gary. Gary says, what can be done for lymphedema swelling in the neck and chin after laryngectomies? I was told by my therapist that a compression garment for the face would cost $5,000 for a new one or $2,500 for a reconditioned one. Well, Gary, I can tell you that I never heard of those excessive numbers. Obviously, compression garments are not inexpensive. However, there are excellent applications that are especially geared for those patients with HNL or head and neck lymphedema. Many are done manufactured by Jovi or Solaris. There are other manufacturers, and the price range is certainly not in the $5,000 range. The price range is around $100 to $350. Actually, we have a website at the Lymphedema store, www.lymphedemastore.com. We have some of those compression garments geared towards facial applications listed there, and you will see that the prices are certainly much lower than those that were quoted to you by your therapist. There's another question that just came in from Yaya. Hi, are there many job opportunities for occupational therapists with lymphedema certification? And at your course, do you teach the evaluation process and how to write evaluation for insurance companies to pay you? And does Medicare and Medicaid pay for those services? Yes, Yaya, we train a lot of occupational therapists, also OTAs, obviously PTAs and other therapists. There is a high demand in lymphedema therapy. Lymphedema, as I mentioned at the beginning of this live stream, is an extremely common condition. There's a lack of lymphedema therapists nationwide, if not worldwide. And yes, we certainly teach the evaluation process during our courses, and yes, lymphedema, obviously it depends on the specific plan the patient is under. Yes, there are CPT codes, like billing codes for lymphedema therapy. It is reimbursable. Now another question, do we have time?
We do, we have just a couple more minutes.
Okay, another question from Nareda. I hope I pronounce your name correctly, Nareda. If not, I apologize. I am a renal patient and I have seen a specialist and he diagnosed me with lymphedema on my left arm. Now, I doubt that your renal insufficiency has any correlation with your upper extremity lymphedema, but I'm not a doctor, so just my feeling. I've done a test and those tests came out normal. I've also seen a surgeon to see what can be done for the swelling or to operate on my arm. There's some blockage. What are some home remedies that I can do to ease pain on the swollen arm? Now, Nareda, first of all, you can do a lot of things at home to mitigate those symptoms. However, I would highly suggest that you seek first the advice of a certified lymphedema therapist. Now, how can you find a certified lymphedema therapist? We have a therapist finder on the Academy website, acols.com. We have also a therapist finder on lymphedemablog.com, and not only therapists that were trained by the Academy, but also therapists that were trained by other schools that meet the requirements set by LANA. So I would urge you, Nareda, please go and see if you find a certified therapist in your area. Just type in the zip code and it will give you hopefully a list of therapists in your area. Now, if this does not work out for you for any reason, yes, there are some home remedies you can do to ease the swelling. For example, decongestive exercises, with your arm elevated, and that's or self MLT technique. Sorry, I just had a blank there. You can learn on the instructions I mentioned before that are listed on the Lymphedema blog website. There are self-MLD instructions on the website that are geared towards helping patient, applying those self-MLD techniques to decongest the arm. I would also highly recommend that you go and find a therapist or a professional that is able to measure you for a compression garment, and also that therapist will be able to tell you to the appropriate compression class. There are certain compression classes. There's compression class 1, 2, and 3 for off-the-shelf garments, and there's compression class 4, a very high compression that is only available in custom-made garments. So yes, there are certain things you can do, but again, look for a therapist. If you can find one, go to lymphedemablog.com. If you can't find one, and you will find certain remedies that are appropriate to take care of those things.
Perfect, Joe. I think we're about out of time.
It looks like it, yeah.
So thank you all very, very much for joining us.